All right, so today, let me just pull up the PowerPoint. So today, we're going to be talking about body mechanics for lifting. And these body mechanics, they can be used not only for lifting exercises, but also for other kinds of exercise like aerobic exercise, such as running or swimming even, and even riding a bike. So there's going to be, um, I'm going to show you a couple different mechanics that will be useful for all different kinds of exercise. So by the end of today, hopefully you will recognize some of the most important protective techniques when lifting weights or doing other exercise, understanding improper techniques or habits, and hopefully you'll be able to apply these to different exercises or activities that you'd like to do. So I'm going to today talk about 5 important body mechanics for safety. And my main focus is to emphasize that safety is the goal here, because as you engage in more or different or more intense kinds of exercise, safety is the key because it allows you to continue to progress. And if you do have some sort of pain or injury, that's going to be something that's going to obviously stop you. So we want to prevent that beforehand to make sure that you don't have any issues and that you can keep doing whatever you'd like to do. So the 5 that we're going to talk about today, and these by no means are the only body mechanics for safety. I just think they are some of the more important ones to remember before engaging in this kind of activity. And I think these are the most helpful for protection. So they are keep a neutral spine, engage your core, bend your knees and hips, control your knees, and breathe. I also just realized I forgot to do an introduction. So my name is Brian. I'm a personal trainer at GW. I'm currently a physical therapy student at GW in the doctorate program. And just a little background about myself. I went to the University of Miami for undergrad and studied athletic training there. So I've been studying this stuff for a little while now, and I love it. So let's get into it. So the first one is to keep a neutral spine. So what do I mean by that? So the spine has natural curvature in it. And so from your head all the way down to the base of your pelvis, there's a natural S curve that your spine is kind of aligned in. And so you want to maintain that curvature as you do your different activities. So here you can see the person who's doing a deadlift, but you want to that natural curvature you want to maintain in all kinds of exercises. So in running and even on a stationary bike, you want to maintain that natural curvature, and you don't want to alter it too much because I'll explain a little bit how that can lead to injury. So on each slide, you'll see a yes, no, and areas to consider tab, just to make it pretty simple for what to do and what not to do. So you want to keep a flat back. And what I mean by that is you don't want to round too much and you don't want to extend too much. So if anything, you want to keep it flat or even a little bit slightly extended. And I'll explain that in a moment. And you also want to make sure that it's controlled the whole time. So what I mean by that is contract your muscles, be active, engage all the muscles that are involved in stability, and keep everything tight and active. And maintain active tension in your muscles when you do these kinds of exercises, such as a deadlift or a squat or something like that. And what you don't want to do is, like the person in the first image is doing, is round your back. You don't want to create excessive flexion or curvature in your spine, because that there's a couple of reasons. So one, you place the muscles in your back on excessive tension. You lengthen them too much, and by lengthening those muscles, you actually make them a little bit weaker. The optimal length for them is not that stretched out position. So you make them a little bit weaker, which ultimately just makes them more susceptible to injury. And another reason that you don't want that flex posture is that the bones of your spine, the vertebrae, sit like this. And if you bend over like that, now they're like this. And in between these bones are discs, and they're there for protection. And so when you go like this, you create more pressure down here and less pressure up here, which ultimately leads to a pressure forcing that disc outwards. And so it doesn't mean that every time you do that, you'll herniate a disc, but it definitely makes you more susceptible for that kind of injury, which can be very painful and stop you from doing a lot of activities. So rounding your back is a big no-no. And so some areas to consider. So naturally, it would make sense that your mid back, your thoracic spine, and your low back, your lumbar spine, are important to consider. But other areas to consider are the shoulders. So you want to make sure that you're not letting your shoulders slouch and round in like a lot of us do when we sit. You want to keep them nice and back and controlled. And I don't mean that you should shrug them up, because that's a common kind of, I would say, movement compensation that people tend to do. You want to just retract your shoulders back. And so the imaging that is easy to consider is, think if there's a soda can in between your two shoulder blades, and you just want to pinch it a little bit. So you just retract the shoulders back a little bit. So you just want to maintain active tension, like I said, and control in the shoulders. And that helps in maintaining a nice neutral flat spine, particularly the thoracic spine or the mid back area. Another area to consider is the neck. A lot of people don't think about the head as being part of the spine, but it is obviously at the top of the spine. And if you look down or up, or even if you were to turn your head for some reason during some sort of activity, it messes up the natural alignment of the spine. So you want to make sure that the head is in line with the spine, and that you're not looking in any drastic direction, like down or up, so that you can maintain the nice neutral spine and prevent any sort of neck pain or other sort of back pain. The next one is engage your core. So what do I mean by core? So everything from your collarbones all the way to around your mid-thigh is what I mean when I say your core. And I don't just mean the front. It's the front, the sides, and the back. So your core actually is a really large part of your body, a large part of your trunk, and there's a lot of important muscles in there. And some of them are really big and obvious, and other ones are smaller, and ones that you wouldn't necessarily think of. They're not like glamour muscles or ones that you can necessarily flex or something. But they're really important for the protection, again, of your spine, and also the rest of your body. So something to consider, a phrase to consider, is you want proximal stability before distal mobility. So what does that mean? That means you want to have stability in your trunk proximally, so closer to your body, so that you're able to be mobile with your extremities, your arms and legs, your hands and your feet. So that's just kind of a core thought to think of. So what do you want to do? You want to suck your belly button into your spine. So a cue that you can think of is to laugh out loud and feel what your stomach does. And that feel the muscle in your stomach, that muscle that squeezes, that's the one that you want to squeeze and control while you're doing any sort of exercise, especially heavy lifting. But even if you're just going for a run or you're on a bike, you want to actively engage your core and protect your spine. That's really huge. And when you're thinking about if you're doing like a leg lift on the floor, some sort of abdominal activity, you want to tilt your pelvis posteriorly. So if this is your pelvis, this is the front side, this is the back side, you want to tilt your pelvis back a little bit. That's what posterior means. You want to tilt it back a little bit, because that will make your low back flat on the ground, and that's the goal. So like you can see in that image, on the top picture, you can see that person's pelvis is tilted backwards, and their spine is pressed to the floor. And that is the safest, most protected position for the spine when you're doing any sort of activity like that on the floor, or any sort of lifts or something like that. And also if you're doing a bench press, it's important to engage your core and make sure that your low back isn't arching off the table. You see plenty of people go to do bench press and they're pushing with all their might through their arms, but their whole back is off the table, and that's just not good for you. So you want to squeeze your core muscles throughout the exercise, not just the beginning or the end. You want to keep a nice tension in there the whole time. What do you not want to do? Allow the pelvis to tilt anterior, so allow it to tilt forward, like that middle image that you can see, because that creates an arched spine. So this goes hand in hand with the tenet of keeping a neutral spine. And you don't want to not have active control during the movement of your arms and legs. So perfect example is doing a bench press. It's not inherently a core exercise, but you can very easily engage your core and squeeze it so that you do get some sort of activity, and strengthening of your core while you're doing something that is otherwise a chest exercise. And like I said, you want to prioritize stability before mobility. So keep the core nice and engaged. It protects your back, and it protects some of your other proximal joints like your shoulders and your hips. So that leads me to the next one, which is to bend your knees and hips. And so What do I mean by that? Is if you look, I'm going to direct you to the image on the right immediately. So a lot of people, when they go to bend over to touch your toes, they do a lot of motion. You can see a lot of motion in their back. So they're flexing and bending their spine a lot, but they're actually not bending at their hips very much. So they think they have tight hamstrings, and they very well might, but really they're only bending at their trunk, so they can't really tell if they're moving their hips or not. So something to tell how much you're moving your hips is to hold a broomstick or something behind your back like that, like the woman is in the image, and try to bend forward at your hips and keep the bar or the broomstick flat on your back and see how far you can go. So that's something that you have to actively think about to bend your hips, and you also need to bend your knees, just for protection of your body and of your back. So you want to remember to bend them at the same speed, which I'll get back to in a minute. Knees over toes. So a lot of people hear that the idea of knees over toes not being safe and that being painful. If you think about walking up the stairs and down the stairs, you can't do that without your knees going past your toes, which is kind of interesting. A lot of everyday activities, your knees have to go past your toes. So it's pretty natural for that to happen. When what people are referring to is if you have some sort of knee pain, some sort of anterior or front knee pain, and your knees go past your toes when you're doing a squat or something like that. If your knees go past your toes and you're putting more compressive force, your kneecap gets pulled into your bones more, and you feel a little bit more compressive force. So that can be kind of painful. But if you don't have any knee pain, then that's not really an issue for you. So knees over toes can be okay. If you have knee pain, then it's more important to keep your knees back, control that. But otherwise, it's okay. As long as your heels and your feet stay flat on the floor during squats and things like that, as long as you don't feel knee pain, it should be okay. Generate force from your legs. So when you're doing any sort of heavy lifting, it is very easy to let the weight go onto your back and lift with your back. And that is the easiest way to get hurt. You want to make sure that you're generating force from your legs. And that's part of the reason why you have to bend your knees and your hips at the beginning of the exercise, so that you have a place from which to generate that force. So you want to make sure you're driving your heels into the ground, keeping your weight back onto your heels and generating enough force to perform whatever activity you're trying to do. And like I mentioned, keep your heels on the floor, just because you want to load the appropriate muscles. And if you're up on your toes, you're doing a heavy lifting activity with your calves, and that's not right. So you want to make sure that you're sitting back on your heels and loading the appropriate big muscles of your legs that you're trying to work, like the glute muscles at the hips and the quads and the hamstrings, the real big ones that are meant to take more load like that. What you don't want to do, like I mentioned, is generate force with your back. That's an easy way to put too much load. And without getting too much into the biomechanics of why that's not good, those muscles are big, but they are not strong enough to lift the weight that you would be trying to lift with your legs in the same fashion. They're not optimally positioned. The weight is too far away from where those muscles can generate force for that to be effective. So you're really putting your back muscles on a lot of strain, and that can just lead to injury. So you want to avoid that. And you don't want to keep the knees and hips stiff. You want to bend them normally. You want to flex and extend those joints, using the large muscles like I mentioned, with those activities. And like I said, a lot of daily activities require the knees to go past the toes. So it's something to consider if you have knee pain and you don't want your knees flying past your toes. But if they go a little bit past and you don't have any pain, that's okay. And you want to always remember, as part of keeping your spine neutral and your core engaged, you want to keep your chest up and your shoulders back. So you don't want to shrug them, but you want to keep your shoulders nice and engaged, keep the trunk stable, keep the core engaged, keep the spine neutral. So as you're seeing, a lot of these things go hand in hand, when you're doing a lot of different activities. And so you have to think about them a lot initially, but eventually over time they become more natural and it's a lot easier. And also, aside from lifting, if you're going for a run, you also want to keep your chest up and your shoulders back, because if you're running with a posture like this the whole time, if you train in this posture, that's the posture that you're gonna have. And lately, since we've all been home, we're probably all having a little bit of this posture. So you want to make sure that you're sitting up or standing up nice and tall when you're doing these exercises, so that you train in the posture that you want to have. Fourth one is control your knees. So what I mean by that is to make sure that when you go for a squat, the squat is the easiest way to demonstrate this, is you want to make sure that when you bend your knees down, or when you bend your body down, you bend your knees, that your knees stay straight in line with your feet. You don't want them to bend inward. That's called a valgus movement. It's as if somebody's pushing your knees from the outside, like you can see in that image on the right with the red X. You don't want your knees to bend in like that. The reason why is because it means it could mean that you're not activating enough of your hip muscles enough that pull your hips in an outward position. It could mean that, but what that leads to is knee pain, and knee pain stops you from exercising. And so in order to make sure that you don't get knee pain, you want to make sure that you're actively controlling your hip muscles, so that your knees stay at least straight and that they go somewhat in line with your feet. You don't want them to cross the midline of your foot and go too much inwards towards the midline of your body, if that makes sense. So the image on the right kind of perfectly exemplifies that. So the individual on the left, his knees look like they are straight right above his feet, which is perfect. And on the right, you can see that they clearly are, they are medial. They are inside of the alignment of his feet, which is not good. And you also don't want your knees to track too far outward similarly, but the more common movement pattern is for people's knees to track inward. So you want to make sure that they're staying nice and straight. You also don't want to let your knees wobble during these activities, because that means that you're not really actively controlling their glute muscles on your hips. So you want to make sure that you keep those nice and strong, so that you can do these activities properly and not develop any sort of pain or injury. Something to consider, some ways to train these muscles, because they might not be inherently active, depending on the individual. You want to use, they have those stretchy bands, TheraBands. You want to use one of those around your knees. And in the beginning, if you've never done this before, use one of those, put one of those around your knees and stand in front of a mirror and start doing squats, and put your feet shoulder width apart and start doing squats, and watch the position of your knees. As you go down, you see your knees start to get closer together, that means you likely need to activate your hip muscles a little bit more and try to turn your knees out a little bit. And so that's a easy way to set up some feedback for yourself, so that you can see how your knees are tracking during a squat activity, so that when you go to do other activities, maybe like a lunge or a leg press or even running, you can make sure that your knees are staying aligned and that your glute muscles are active. And again, what we're trying to do here is to prevent pain in the knees by loading them improperly. It closes off part of the joint space and opens up another part, and that improperly loads the joint, which can not only lead to pain, immediate pain, but it can also lead to long-term pain and joint changes that may even lead to the development of arthritis, which obviously we want to avoid when exercising. And the last one that I have is breathe. So it seems rather simple, but if you go to a gym and you watch people lift weights, you'd be probably surprised by the number of people that hold their breath during an activity. So you really want to make sure that you're breathing the whole time. So you want to, so it says here, you want to inhale on the way down and you want to exhale through the way up. So when I say down and up, I'm referring to a squat. So the eccentric portion, where you're lengthening your muscles, you're getting into a more elongated position, but in a controlled fashion. That's what eccentric means. It's the down portion. So you want to inhale through that portion and you want to exhale through the way up. And at no point in this do you really want to hold your breath, because the way that you're exercising, you want to get oxygen to your tissues. Even if you're doing some sort of anaerobic, meaning without oxygen activity like a squat, you need to breathe. You don't want to hold your breath, like I said, during any part of the activity, because doing that can build up, it's called a Valsalva maneuver. So what it means is you build up pressure throughout your abdomen and your trunk, and this pressure if you do this all the time consistently, over time can have a harmful effect on your cardiovascular system. So it can increase your blood pressure systemically, actually. And increasing your blood pressure over time can lead to a greater risk of other complications like having a stroke or a heart attack or other harmful conditions like that, that obviously you would not want to cause just by holding your breath. And it's not a 100% correlation that if you hold your breath, you will have a stroke. It's just that you can put yourself at greater risk for it, which obviously you don't want to do. So it's important to remember to breathe throughout the exercise, appropriately oxygenate your tissues, give your brain oxygen and blood. You just want to keep everything moving while you're exercising and not really close yourself off from oxygen, because in activities like these, that's not really the goal, and it wouldn't be appropriate for this time. And so I'm going to go through 3 questions for you. I'll give you a second to come up with the answer yourself, and then I will share it with you. So number 1, true or false? When doing a push-up, you should tilt your head back and look straight ahead and not at the ground. And so the answer here is false. So you want to look straight at the ground because the alignment of the spine, as you can see, is horizontal to the ground. And if you were to pick your head up, you would be making the spine like this, and then your head is like this, and that's not aligned. So you want to make sure that they're nice and even like that. So this individual in the picture, he's doing okay, but he's lifting his head up a little bit. So you want to make sure that you're just looking straight at the ground and keeping the alignment of the spine neutral. Number 2, which of the following is not correct when performing a squat? A, keep the knees straight and glute muscles engaged. B, keep the heels down on the ground. C, bend your knees more than your hips. D, breathe throughout each repetition. All right, so the answer here is C, bend your knees more than your hips. Like I mentioned, you don't want to bend, you don't want to give any preference to either one of these joints. You want to make sure that you're generating force through both your knees and your hips, and that you're avoiding excessive movement of your back. You want to keep your back nice and strong. You do want to keep the knees straight and the glute muscles engaged to keep it nice and strong and controlled. You want to keep your heels on the ground to make sure that you are applying the load and the force through the appropriate muscles at the appropriate joints, or across the appropriate joints. And like I just mentioned, you do want to breathe throughout each repetition to make sure that you're oxygenating your brain and your other organs and your heart and other tissues and stuff. Last one, which person is doing a leg lift correctly, A or B? So the answer here is going to be B, because as you can see, this individual's spine is low back is flat on the ground, which means that she's engaging her core muscles, which is exactly what we want to do for protecting the spine and making sure that we're engaging the right muscles and not just the hip flexors when doing this activity. The person on the left in picture A, it's kind of tough to tell, but it does look like his pelvis is kind of tilted forward anteriorly, and that there's a little bit of a curvature in his back. It looks like the middle part of his back and his chest come off the ground. And although we can't see for sure because of his arm, it definitely looks like it's a little less controlled than the person on the right. So just something to consider. You want to make sure that your core is engaged and your spine is neutral. And that's my references. So I hope you guys enjoyed this. Just some tips to be able to remember when you're doing any sort of exercises, whether it's lifting weights or doing any sort of resistance exercise or doing any sort of cardio exercise. So you can apply these however you'd like. And so hopefully they keep you safe and you can keep doing activities. Hope you guys liked it.